There's a saying, you never know what someone is going through.
Because I lost my first child, I couldn't do one thing about his heart defect. But I can do everything about my son's education and his mental health. And I can try to be that bright light for another mama who thinks she's just about to go take her own life because she just can't deal with it anymore.
But Julie Crump knows exactly what it's like to put on a brave face.
Good morning.
Monday through Friday, she's at River Hills Tennis Club, creating the most beautiful dining room for special events. But when she goes home, she's faced with the reality millions of parents deal with, a teenager who struggles with their mental health.
Because I knew he was depressed. I knew his anxiety was out the roof for no other reason than he was a mess inside and didn't know those emotions at that age. It's just now at 16 that he's starting to understand his own mental health capacity.
Crump's situation is critical but relatable. Her brother took his own life at the age of 49. She had to bury her 1-year-old son for medical reasons, and her now teenager at the age of 11 was suicidal. Crump says therapy saved her family.
He advocates now for his own medicines, but he wouldn't be doing those things if it hadn't been for us finally finding the right help.
But when it comes to mental health and going to therapy, so many Mississippians don't know where to start.
When I first started, there were lots of days where I'm just like, okay, I'm waiting for somebody to call, and those days were long gone.
Martha Hollingsworth can tell you exactly what the need for mental health looked like 25 years ago. She's been practicing for that long, but has been a counselor with the Rankin County School District for 19 years. And over that time, things have changed.
The first 15 years, it was just me for the whole district.
Oh, wow.
But, about 4 years ago, like I said, everybody's seeing the growing need.
4 years ago would put us at the start of the COVID-19 pandemic, a public health crisis that forced people to take a second glance at their own physical and mental health.
I think there's always been a need, but it wasn't talked about.
According to a 2024 USA Today article, 273,000 Mississippians are affected by mental health. The grim statistic is 56% of them aren't getting the help they need. According to Clinic Tracker, the top 3 reasons people don't seek therapy is the cost, people believing their problems aren't serious enough, and number 1, the stigma on seeing a therapist.
I think the reduce in stigma and people realizing that mental health is health, it's just as important as physical health, has opened up those doors.
Bringing awareness to mental health in Mississippi.
It's going to be changing. It's going to change forever. And your kid that's suffering now, that suffering's going to change as well, because ours does weekly.
Michaela Franklin, 16, WAPT News.
Well, as part of the effort to connect more people with mental health resources, the Mississippi Department of Mental Health is launching a new mobile app. That app includes a resource directory, a map to find mental health services in your county, crisis support and resources, as well as educational materials on mental health conditions and treatment. The app is available for download now. It can also be reached at mentalhealthms.com.